Hello everyone, this is Dr. Audrey Tai. I'm a board-certified and fellowship-trained LASIK and cataract surgeon, ophthalmologist, and cornea specialist. Welcome back to my channel, Eye Channel by Eye Surgeon. In today's video, I would like to talk to you about the science behind the ingredients in artificial tears. These are the over-the-counter eye drops for treating dry eye disease. This video will help you understand the differences between different dry eye drop ingredients, and it will help you choose the artificial tears that work best for you. You can navigate to different categories of ingredients by clicking on the navigation bar below. If you want to jump right into my list of favorite artificial tears for treating dry eye disease, you can check out my video on my top 5 picks of artificial tears. Or if you would like to learn more about the science behind the ingredients of different artificial tears and why I would recommend certain artificial tears over other ones, stay here with me, and we will go over that in this video. I've also listed links to my favorite artificial tears in the description below. To learn more about my practice, you can follow me on Facebook and LinkedIn at Dr. Audrey Tai. And if you have learned anything new from this video, don't forget to like and share this video. I will also be posting a more in-depth video about the mechanisms of dry eye disease and different types of dry eyes, so make sure you subscribe to my channel so you won't miss any of my new videos. Without further ado, let's talk about the ingredients in artificial tears. The ingredients of artificial tears can be categorized into 3 groups: active ingredients, inactive ingredients, and preservatives. The active ingredients are the agents that have been approved by the FDA to be used in artificial tears to provide lubrication to the eye. There are 3 main categories of active ingredients in artificial tears: astringent, demulcent, and emollient. The most commonly used ophthalmic astringent is zinc sulfate. 2 common brands of dry eye drops that contain zinc sulfate are Clear Eyes made by Prestige Consumer Healthcare and Visine made by Johnson & Johnson. Zinc sulfate can help reduce the burning and itching sensation from exposure to the pollutants in the air by reducing the mucus on the surface of the eye, so it can help reduce some allergy symptoms. But zinc sulfate is not very effective in lubricating the eye compared to other active ingredients, so it is not a top ingredient in artificial tears that I would recommend for my patients to treat their dry eye disease. The second group of active ingredients is called demulcent. This is the main ingredient in artificial tears, which determines the consistency and thickness of the drop. Demulcents are typically mucoprotective agents. They reduce inflammation and irritation of the mucous membrane of the eye and hold moisture to lubricate the surface of the eye. They act on both the aqueous and the mucin layers of the tear film. There are a few common demulcents used by different brands of artificial tears. Carboxymethylcellulose sodium, CMC, is the main demulcent in Refresh brand artificial tears made by Allergan. Sustain brand of artificial tears made by Alcom typically contain polyethylene glycol or propylene glycol as their demulcent. The other commonly used demulcent agent is hydroxypropylmethylcellulose, or HPMC. It is the demulcent used in Gentile brand artificial tears made by Alcom. Variation in the concentration of the demulcent, such as CMC, affects the consistency and the viscosity of the artificial tears. For example, Refresh Optive Gel Drop contains 1% CMC, which is double the concentration of CMC in the regular Refresh Optive eye drop. This allows the gel drop to provide a longer-lasting lubricating effect. However, the higher concentration of demulcent used increases the thickness of the artificial tears. This will require more blinking action by the eyelid to spread the demulcent polymer over the surface of the eye. Therefore, if you use a gel eye drop, you may notice it takes a little bit longer and more blinks to clear your vision after you put in the eye drop. The third category of the active ingredients is emollient. An emollient is usually a fat or oil providing a long-lasting lubricating effect, and the eye drops which contain emollients tend to be thicker and take longer to clear up. So the liquid formulations of artificial tears typically do not contain a large amount of emollients. For example, mineral oil is a commonly used emollient and is intended to replace and thicken the lipid layer of the tear film in order to provide and improve the stability of the tears and slow down evaporation of the tears. More commonly, emollients are found in ointment formulations of artificial tears, such as Refresh PM and Sustain Nighttime Eye Ointments. These formulations are more frequently used before bedtime and reserved for moderate to severe dry eye disease. Some newer liquid formulations of artificial tears that target all three layers of the tear film, including the lipid layer, often contain a small amount of emollient to provide a longer-lasting lubricating effect to the eye. Artificial tears which contain emollients are a little bit thicker, so after you put in a drop, make sure you blink a few times to spread out the eye drop across the surface of the eye. You may notice the vision is a little bit blurry and it may take a few blinks to clear up your vision. I've included the links to a few examples of those newer formulations of artificial tears in the description down below. Now you have learned about the active ingredients in artificial tears, and the next main category of ingredients is the inactive ingredients, such as sorbitol and sodium hyaluronate. Sodium hyaluronate is one of the most commonly used inactive ingredients in artificial tears to provide additional lubrication to the surface of the eye. Sodium hyaluronate is a derivative of hyaluronic acid and it is hypoosmotic. What this means is that it can actually lower the osmolarity of the tears. It is made naturally by the eye when there is damage to the surface of the eye, and it helps repair damaged cells on the epithelial layer of the cornea, which is the outermost layer of the cornea. It also reduces inflammation on the surface of the eye. Sodium hyaluronate has better osmolarity lowering properties than glycerin. A few examples of artificial tears that contain sodium hyaluronate are Sustain Complete, made by Alcom, Refresh Relieva, made by Allergan, and Blink Artificial Tears, made by Johnson & Johnson. Other common inactive ingredients include electrolytes, such as magnesium chloride and potassium chloride. Electrolytes are typically added to the artificial tears to lower the osmolarity of the tears to prevent it from pulling water away from the superficial layer of the cornea and drying the surface of the eye. The last category of artificial tear ingredients I want to spend some time to talk about is preservatives. All preservatives used in artificial tears are somewhat toxic to the surface of the eye, to varying degrees. Therefore, I recommend my patients to use preservative-free artificial tears whenever possible. However, the preservative-free artificial tears are typically packaged in single-use vials, and they are more costly and inconvenient when compared to the artificial tears packaged in multi-dose bottles. Preservatives play an important role in preventing contamination of eye drops stored in multi-dose bottles. Bacteria, fungus, and other contaminants can potentially cause infection on the surface of the eye. Not all preservatives have the same level of toxicity to the surface of the eye. Some are more toxic than others. Let's take a closer look. There are three main types of preservatives used in artificial tears: detergent type, oxidative type, and ionic buffering systems. The detergent type of preservative is the most toxic one to the surface of the eye. One of the most commonly used detergent preservatives is BAK, short for benzalkonium chloride. It is a common preservative used in many different types of medication eye drops, such as antibiotic eye drop and glaucoma eye drop. It kills bacteria by destroying the lipid on the cell membrane of the bacteria. Some examples of artificial tears containing BAK are Visine Dry Eye Relief and Clear Eyes Redness Relief, as well as Soothe long-lasting artificial tears by Bausch alone. Polyquat is another commonly used detergent type of preservative that is derived from BAK. It is unique because it can attract bacterial cells, but the epithelial cells on the surface of the cornea tend to repel it. Therefore, it's better tolerated and less toxic than BAK. Polyquat is the preservative used in the Sustain family of artificial tears. The oxidative preservatives are less toxic to the surface of the eye than the detergent preservatives. Purite is the brand name of a stabilized oxychloral complex preservative used in the Refresh family of artificial tears. It is an oxidative type of preservative. When exposed to the light, it degrades into water, oxygen, sodium, and chlorine free radicals. It kills bacteria by interfering with bacterial protein synthesis. There are other types of oxidative preservatives in other brands of artificial tears. For example, sodium perborate, also known as Genequa used in Gentile brand artificial tears, and DQuest used in TheraTears brand artificial tears. OcuPure is another type of oxidative preservative that is similar to Purite, and it is used in Blink brand artificial tears. Now you have learned all about artificial tear ingredients. Please check out my video on my top 5 picks of artificial tears. Thank you for watching, and I hope you find this video helpful in learning more about the science behind the ingredients of artificial tears. So the next time when you go to a pharmacy to pick a bottle of artificial tears, you will know the differences between them, and you pick the one that works the best for you. Let me know which over-the-counter artificial tears and the dry eye drops are your favorites in the comments below. If you find this video helpful, please don't forget to like and share this video and subscribe to my channel to help me bring you more videos about eye health and eye surgery. To learn more about my practice, you can follow me on Facebook and LinkedIn at Dr. Audrey Tai. Thank you again for watching, and I will see you in my next video.